Welcome, class. This is Emergency Medical Responder, Chapter 6, The Human Body, and it's a long one. We'll see if we can get through all of it in one recording. We'll see. Okay, National EMS Education Standards Competencies, Anatomy and Physiology uses simple knowledge of the anatomy and the function of the upper airway, heart vessels, blood, lungs, skin, muscles, and bones as a foundation of emergency care. Lifespan Development uses simple knowledge of age-related differences to assess and care for patients. Introduction. You must understand the basic structure and functions of the human body. This knowledge will help you better understand the specific location of symptoms the patient is experiencing, perform an adequate patient examination, and communicate your findings to others, and provide appropriate medical treatment. Topographic anatomy. So these are just kind of the descriptions. If you look on the top, it says medial and lateral. Medial or anything towards the midline, the yellow line going up and down is medial, and anything to the left or right of that yellow arrow is considered lateral. We have superior, which is the top of the body, and inferior, which is the bottom of the body. And we have anterior, which is the whole front side of the body, and posterior, which is the whole back side of the body. And then one last thing we have is proximal and distal. So your extremities, your limbs, your arms, your legs, appendages, whatever you want to call them, they have what's considered a point of attachment. So your arms attach at the shoulders and your legs attach at the hips. So they use distal and proximal when they're talking about attachment. So proximal, if they were talking about the shoulder area, they would talk about that would be the proximal area of the arm. And if they were talking about your fingers, that would be the distal area of the arm. But you could also say just distal to the antecubital area, which would be just below the bend of the arm there. So those are the main directional terms. The standard anatomic position is a person standing and facing you. If anybody's had anatomy or biology, you've probably heard an anatomic position, with arms at the sides and thumbs pointing outward. Anterior is the front surface of the body. Posterior is the back surface of the body. So everything I just said from the picture. The midline refers to an imaginary vertical line drawn from head to toe that separates the body into a left and right half. Standard anatomic position, medial closer to the midline, lateral away from the midline, proximal close, distal distant, superior closer to the head, and inferior closer to the feet. To review those again. The respiratory system, we'll start there, consists of all structures of the body that contribute to breathing. It brings oxygen into the body and removes the waste gas, carbon, and carbon dioxide. The respiratory is made up of the upper respiratory, which is your mouth and nose. Then the trachea is your windpipe. You have the lungs. Your diaphragm is your muscle for breathing. You have your main bronchus and then your bronchioles, the ribs, and the carina is the like the junction where the two bronchioles or the main bronchus split. The airway consists of nose or nasopharynx, mouth, oropharynx, throat or pharynx by itself. Larynx is your voice box, trachea is your windpipe, and the passages within the lungs. So this is just more pictures. We got your nasal cavity, you have your mouth, you have your nasopharynx, oropharynx, pharynx, epiglottis is the flap in between the voice box and the esophagus that kind of opens and closes depending on whether you are breathing or eating. Esophagus, trachea is your windpipe, and then you have your lungs. Oxygen and carbon dioxide are exchanged in the alveoli and tissue. So they've taken just a little piece of the lung out to blow it up and show you what the alveoli look like. There's an artery and a vein in there, and then there's tiny air sacs. And in the tiny air sacs, in the capillary network, you see where the arteries or veins are coming down and then meeting together. That is in the capillary network, and that's where CO2 and carbon dioxide are exchanged. Air is inhaled when the diaphragm and the chest muscles contract. Air is exhaled when these muscles relax. So it's just kind of showing you, the top picture is in inspiration where they're breathing in, and the expiration is the bottom one, breathing out, what their lungs look like in those situations. Now we're on to circulatory, which includes the heart, blood, and blood vessels. So we have lungs, we have heart, we have your aorta, which actually comes out the top of the heart and then down through the body. And then we have the inferior vena cava, inferior and superior vena cava. The flow of blood picks up oxygen in the lungs and goes to the heart. The heart pumps it to the rest of the body. The cell absorbs oxygen and nutrients from the blood and releases waste products. Blood carries the waste back to the lungs and kidneys. In the lungs, the blood exchanges the carbon dioxide for more oxygen. The heart consists of 4 chambers. Each chamber is called an atrium. Each of the upper chambers, is called the atrium, and each lower chamber is called a ventricle. The chambers work together to pump blood to the lungs and to the rest of the body. One-way check valves allow the blood to flow in one direction only. So there are 4 chambers, and there's also 4 valves. This is the picture of the anatomy of the heart. You can see that's where the aorta comes up out of the heart, and then it goes all the way down through the body. You got your pulmonary arteries that have just take blood to the lungs. Your pulmonary veins are bringing blood from the lungs back to the heart. Your atriums right there on top. You got your right atrium, your left atrium, and then your bottom ventricles, left and right ventricles. The arteries carry blood from the heart at a high pressure, and therefore they have thick walls. There are 3 major arteries: neck or carotid artery, and that's the artery that we would check for a pulse with CPR. Groin or femoral artery. I don't know if you remember during CPR, they were checking the femoral artery to make sure they were pumping correctly. And then the wrist is your radial, which is the most common place that we take a pulse, right? So you got your carotid, femoral, and radial. The capillaries are the smallest vessels. The veins are thin-walled vessels that carry blood back to the heart. Blood has several components. We have plasma, we have red blood cells, white blood cells, and platelets are the main components of blood. We're on to the skeletal system. Skeletal system consists of bones and connective tissue that protect and support the framework of the body. It has 3 major functions: to support the body, to protect vital structures such as your ribs, protecting your heart and lungs, and to manufacture red blood cells, because those are made inside the bones and the bone marrow. Skeletal system, this is just a real short version of what it is, but we have our skull, we have our shoulder girdle, or also referred to as the pectoral girdle, which includes the clavicle, collarbone, and scapula, which is shoulder bone. We have our ribs, we have our vertebrae, we have our arms, which consist of the humerus, ulna, radius, is your upper extremity, and they're not even going to talk about our phalanges, but that's your fingers down there. We have your lower extremity. The big bone is the femur, knee bone is your patella, and then you have a tibia, which is considered your shin bone, and the fibula, which is considered your thigh bone. Not thigh, I'm sorry, calf. The skull, the bones of the head include the skull and the lower jawbone. The skull consists of many bones fused together to form a hollow sphere that contains and protects the brain. The jawbone is a movable bone that is attached to the skull and completes the structure of the head. The spine consists of 33 vertebrae. The spinal vertebrae are stacked on top of one another and are held together by muscles, tendons, discs, and ligaments. The spinal cord passes through the hole in the center of the spinal vertebrae. The spine has 5 sections. Your cervical spine is your neck, so you'll hear a lot in EMR C-spine, and they're talking about the vertebrae in your neck. Thoracic spine is your chest, so every thoracic vertebrae leads to a thoracic rib. So all 12 ribs are your thoracic spine. Part of that. And then below the ribs is your lumbar spine, and your sacrum is at the base of the spine, and your coccyx is your tailbone. So there it shows that again. We've got 7 vertical, 12 thoracic, which match up with your 12 ribs, your lumbar, your sacrum, and your coccyx. And they call it the coccygeal. The shoulder girdles, each shoulder girdle supports an arm and consists of 3 bones, the collarbone, the shoulder blade, and the upper arm bone, humerus. The upper arm extremity consists of 3 major bones. The upper arm has 1 bone called the humerus. The forearm has 2 bones called the ulna and the radius, and the wrist and hands consist of several bones, and those are your carpals and metacarpals and phalanges. The rib cage, the 12 set of ribs protect the heart, lungs, liver, and spleen. The rib cage, the sternum is located in the front of the chest, and of course that's where we're pushing for CPR. We push on the lower part of the sternum. The xiphoid process is the pointed structure found at the bottom of the sternum. So you can see that there, that's the place that we want to avoid with CPR. The pelvis serves as a link between the body and the lower extremities. It protects the reproductive organs and other organs located in the lower abdominal cavity. Each lower extremity consists of a thigh and a leg. The lower extremity, the thigh bone or the femur, is the longest and strongest bone in the entire body. The leg has 2 bones. I would call it the lower leg, but unless they're going with thigh and leg. The leg has 2 bones called the tibia and fibula. The knee cap or patella is a small flat bone that protects the knee, front of the knee joint. The ankle and foot contain a large number of smaller bones. Joints are where 2 bones come in contact with each other. A joint is formed, held together by supporting tissues called tendons and ligaments, lubricated by a thin fluid that is contained in a sac surrounding the joint. So joints, there are 3 types of joints. There are fused joints, hinge joints, and ball and socket joints. You can see that first one is a ball and socket, and there are 2 main places where you have a ball and socket will be your shoulder and your hip. Skeletal muscles provide support and movement, alternately contract and relax. Smooth muscles carry out automatic functions, also known as involuntary muscles. Cardiac muscles is found only in the heart. Okay, the nervous system governs the body's functioning. It consists of the brain, the spinal cord, and the individual nerves that extend throughout the body. So there are sensory and motor areas in the brain, and sensory, let me see, you got your peripheral nerves, your spinal cord, motor nerve, so they're going to explain this more when I go on, I'm sure. Okay, the brain is the body's central computer and controls the following functions: thinking, voluntary actions, and involuntary actions. The spinal cord is a long tube-like structure that extends from the base of the brain. Okay, we're going to stop there. So your first video will be only through the nervous system, and I'll have to do a second video for the digestive and on.